Hi everyone, welcome on back to my channel. My name is Iris and this is my 4 months post-op for my myomectomy. So I actually wanted to come back earlier than this, probably at the 6-week mark, but I didn't. So a lot has happened as far as, healing and things like that. So I had my myomectomy about 4 months ago on June 7. And if you want like a backstory of everything that I've been through, I do have a playlist about my fibroids and my journey to get to my myomectomy. So I'll try to link that down below in the description box. So everything has been pretty good, pretty amazing. I feel 100 times better than I did when I previously talked about my fibroid journey. If you don't know what fibroids are, they are benign tumors that form in your uterus. They can either form on the inside of your uterus or they can form on the outside of your uterus. And they cause issues for some people depending on how big they are or how many you have. Or some people could have them and they have no issues at all. So I didn't find out I had my fibroids until I got pregnant with my first child, and that was in 2014. And so I had them since then, or found out I had them since then. I believe I had them before that time, but I don't think they were causing me any issues until I got pregnant. So I've been in and out of the ER and complaining to my gynecologist for years now about pain that I was feeling in my legs, my arms, my abdomen. It was just a constant progression of pain, I want to say. It started with my abdominal pain, the sharp pain in my abdomen, throughout my pregnancies. And then, I had 2 pregnancies, so I have a 7-year-old and a 4-year-old. And with both of those pregnancies, I had the fibroids. So it was very uncomfortable being pregnant with a child and you have fibroids on top of that, because you have to remember that fibroids feed off of blood supply. And when you're pregnant, you're producing a lot more blood than usual to support your baby. So that's when the fibroids actually thrive and grow even bigger, which is what happened with both pregnancies. So after I was done having my children, the pain just got severely worse after year up until 2021, which we are in. It was like my health was declining because of these fibroids. It started out with sharp pain in my abdominal area, and then it started giving me pins and needles in my arms and in my leg. So my gynecologist, she wanted to take out my entire uterus, which I was against doing, which is what most doctors want to do. They want you to just get rid of the uterus because fibroids can grow back if you do decide to do a myomectomy and have them removed. But to be honest with you, I'm not even sure if I'm done having children. I'm not extremely young, but I'm not extremely old either. I'm 38 years old. So I feel like, I know from a doctor's standpoint, I'm past the age that they would recommend me having children because, high risk or whatever. But people today have kids in their 50s, late 40s. I just don't believe that's anything I need to worry about. So I still wanted to keep my uterus just in case I wanted a 3rd child. So finally, after me complaining so much to my gynecologist and she just getting tired of prescribing me different medications and, we going back and forth with removing my uterus, she suggested I go see a specialist, which is an oncologist. An oncologist is a surgeon who deals usually with cancer patients. So if you have cancer within your uterus, that's what an oncologist is specialized in. So since fibroids are benign, they're non-cancerous, they're still growths within your uterus, and he is a specialist that would be able to deal with that. Now, my gynecologist, she let me know that she wasn't able to remove the fibroids like that. She was only able to, do surgery for me if I wanted to remove my uterus. So that's why she sent me outside of her office to the oncologist. So I set up the appointment with him. He went over my ultrasound and everything from my gynecologist, and through that ultrasound you could only see 3 of the fibroids. And he notified me that there was also a cyst that was on that ultrasound, and that he would be willing to remove the cyst and the fibroids. And he also let me know that the only reason he would remove my entire uterus is if he found any cancer within my uterus, which would be from the fibroids, if they did turn out to be cancerous. But usually, mostly out of most cases, they're not. It's really rare that you have someone with fibroids where the tumors actually turn into cancer. So set up the surgery, went through the whole process and everything. So surgery goes great. I get sent home, and that's when the real healing and dealing begins, I would say, because I'm gonna be honest, me going into the surgery, I was like, this is going to be easy. I've had 2 C-sections. I'm good. I know how the recovery goes. I've been through 2 6-week recoveries with C-sections. This is going to be, in my mind, a piece of cake, because I've already been through how this is going to go, and I've already been healed 2 times, going through the process of healing with my abdomen being sliced or cut, to deliver babies. But this healing process, I would say it wasn't the issue with my incision. That wasn't the issue, which you would think it was because that's where I got cut. It was the gas pain. I mean, I was not prepared for the severe gas pain that I had with this surgery. And it started in the hospital. And the nurse warned me in the hospital. She said to me, you need to get moving, you need to get up, because let me tell you something, the gas pain is going to be the worst pain you feel rather than your incision. And I chuckled because I'm like, what is she talking about? My incision hurts. Of course, I'm on medication, so I can't really feel it while I'm here, and they of course prescribe you medication when you go home, so you really don't have to be in that much pain, or no pain at all. But she was right. Laying in the hospital bed, and my chest started to feel tight, and there was this air bubble that I just couldn't get out. It was just stuck there. And it's I would try to burp, you would need to pass gas sometimes. The gas just needs to come out, and if it doesn't, it starts to get trapped in different places in your body. And that could be anywhere. It could be your leg, it could be your chest, it could be your arm. It could be anywhere, and it's the most uncomfortable feeling you will ever feel if you do get this surgery. So I dealt with that. I want to say from the Wednesday I went home until maybe that Saturday, it was the constant feeling of that gas moving and getting trapped in different places, especially within my top area here. I would say my chest, within my shoulder area. It just would get trapped there, and I would just feel this uncomfortableness, if I had to sit like this all day long and feel uncomfortable, until it moved, until it passed, until it was able to get out of my body, either through me burping or me passing gas. So they tried to give me gas medication in the hospital to help with it, But to be honest with you, like she said, the only way that I felt better is if I kept moving. And now that's like contradicting because you just had surgery, so you're sliced up. So walking isn't like the most easiest thing to do at this point. You're like a little hunched because you don't want to, stretch and, have your incision open or anything like that. So you're kind of like walking really slow. You feel like you've been run over by a train, so to speak. You just had this major surgery. So walking is like the last thing you want to really do. But that was what I had to do to get better with those couple of days. I had to keep moving. I would like lay in my bed, and when I would get that feeling, I would have to get up. Even if I didn't want to get up, I would have to get up and be on the move, walking around my bed. Because I stayed in my room mostly the whole time. I really didn't leave my room. I had help, someone helping me and giving me food and providing for me, things like that. So I really didn't have to leave the room. But it was just, it was a lot, okay? That was the first thing I would say you may experience. I don't know, everybody's experience is different, but for me, the gas pains was the top thing that bothered me the most. Next thing I would say is I got staples. And I've never had staples, even with my 2 C-sections. I believe she used the glue. I don't know what it's called, but it's like a type of glue that seals your incision. And it eventually kind of falls off. It really doesn't, you don't have to go back and get it removed or anything. It kind of dissolves itself, or so to speak. But the incision he gave me was much longer than the incision I had with my 2 C-sections. He did tell me that he was going to follow the line where my gynecologist made the incision for my C-sections, so I wouldn't have an extra, scar, like a scar here and then another scar to, for the 2 different surgeries. So I was happy about that. So he did follow that line. But the thing is, the line is much longer because I don't know why. I would think it would be longer if we had to take out a baby, but it was longer to take out my uterus. Maybe because my uterus was, I don't know, enlarged a certain way. I don't know why he had to do the line so long, but when I saw it, when I first had the dressing and things removed, the bandages and stuff, and I saw it, I was like, oh my God, why is this line so long? But I guess he did use the glue that my previous, gynecologist, she used on my 2 C-sections. But he also added the staples, I guess, as an added security to make sure it did not open or rip. And let me tell you, those staples, I had to have them in for about a week and a half. So from the time, I got the surgery until I saw him at my next appointment after. So he wanted to see me, I believe it was a week or a week and a half after the surgery. He wanted to see me in the office. So I had those staples that whole entire time, and I was in so much pain, not from the incision so much, because I took, if I needed to take, the Motrin, which is what I prefer to take, the Motrin. I prefer to take the Motrin, the 800 milligram Motrin, than the Percocet. That's just me, because I'll take the Percocet in the hospital because it does make you loopy, but I don't trust to take it when I'm at home without, like a nurse or supervision. That's just my opinion. The ibuprofen or the 800 milligram Motrin does the job with relieving the pain while I'm at home. So I was okay taking that if I had any pain from the incision, but I stopped taking that, I want to say that Sunday. So I left the hospital Wednesday and I was taking pills each day until that Sunday. And then I stopped and I was fine. I had no problems. But those staples irritated my skin so bad. I still have little dots where you could see where the staples were, because they're just prying into your skin, and with every movement you make, those staples are like digging into your skin. And I was just over it. I could not wait till I got to my appointment when they removed them, because they were the most uncomfortable thing about the recovery process. Like I said, you would think this whole process would be your incision, you trying to feel better, heal properly. The most pains I had were those gas pains and the staples. The incision was fine. So they did remove the staples at my appointment, and I did record that or have a video when I went. And then they added like little they're like little tapes or little suture tapes that will eventually fall off, when you're showering and things like that on their own. You just can't directly get your incision wet. You kind of have to leave it and pat dry. So I did those for the next couple of weeks, and I want to say maybe like a week and a half to 2 weeks. They eventually fell off on their own. But that was the majority of the pain or the struggle through my healing process within those 6 weeks. But once, even like 2 weeks reached, like 2.5 weeks, I was driving. I really didn't have that much of an issue, starting to drive again.